All right, chapter 4, dealing with documentation. Talking to a lot of different EMTs and paramedics in the field, I think one of the overall least favorite parts of the job is probably documentation. However, this is also one of the most important parts of the job. We all love giving care to people and love treating and helping people, but documenting about it after the fact sometimes is not that much fun. Although this is going to be the thing that helps keep you safe, helps keep you out of court, and helps keep you from trouble, as well as to document and make sure that we're doing a good job and really helping our patients. All right, a PCR or a patient care report is the name of the documentation that we do as EMTs. Now, the functions of the PCR, there are 5 of them. First off, it helps with continuity of medical care. Sometimes these PCRs, after you complete them, are passed on to nurses or doctors so that they can familiarize themselves with what you've done and what care you've given as an EMT. It also has administrative uses. Sometimes our companies or our departments need to bill the patient's healthcare insurance for the care that we provided. It also has different legal uses, and sometimes these PCRs will be called back into court and be used in court on specific cases. It also helps us with CQI. Remember that continuous quality improvement that we learned about in Chapter 1, and it can also be geared for education, learning about what type of things are hurting our patients and what we can do to better help them and better provide care for them. And then lastly, we can also see that these are used for education and research purposes in the field. We have 2 different types of patient care reports. We have paper PCRs and electronic PCRs. Now, most systems are switching to all electronic PCRs. We do still have some systems and some volunteer agencies that will use paper PCRs. You will taught your PCR system when you get in the field, depending on what agency you work for. All right, 2 important rules for documentation. If it wasn't written down, it was never done. So if you listen to lung sounds on a patient and you heard really bad lung sounds, make sure you document. Because if you did not, when you go back to look at that PCR years later, it's going to be assumed, right, that that patient, you never listened to their lung sounds. And secondly, if you didn't do it, don't write it down. Don't lie about something that you didn't do. All right, this is considered a legal document, and you can be held liable and accountable for falsifying a legal document. The Department of Transportation has set down a minimum requirement of information that is required on a PCR. You can click through a couple of the next slides to find out what some of that information is, but there's 2 major categories. There's number 1, the patient information, which includes a lot of the vital signs, demographics, and other things that are important for the patient, and then administrative information. All right, every PCR has these similar sections. All right, if we take a look at the first section, that's administrative information. This might be the patient's health insurance information, or maybe other information like where you pick the patient up from, or maybe the call number or call record number. That could be a lot of different information in this administrative information. But then we also have our second information, which is our patient demographics. This might be your patient's name, age, date of birth, right? Their home address, their phone number, these other things that we'll see in our patient demographics. Every PCR has a vital signs section, and we're required by the DOT to have a minimum of 2 recorded vital signs. All right, we need to make sure that we are rechecking our vital signs and documenting multiple sets of vital signs on our way to the hospital. Every PCR will have a treatment section where we are to write down whatever treatment that we have given them. We should be writing down the treatment, the route of that treatment, and how that patient changed in response to our treatment. The last section is a patient narrative, which is considered to be a short story that you are going to write after the call about that call. All right, a couple pearls of wisdom here for documentation. Number one, remember that the DOT requires at least a minimum of 2 sets of vital signs. Regardless, you should be getting vital signs at least every 5 minutes for an unstable patient and 15 minutes for a stable patient. That means you should have multiple sets of vital signs en route to the hospital. Also, when you document your narrative, remember that this is a brief and thorough picture of your patient and their complaint and their problem. I always think about it like this. If another person were to read my narrative, would they understand it? It should kind of flow like a story, if you will. Another important thing that we need to be familiar with is subjective and objective information. Subjective information are things the patient tells us. So this might say, hey, I'm having abdominal pain. We can't look at their stomach and we can't see the pain, right? But this is something the patient is telling me. Objective information, on the other hand, is measurable information. I can look at my patient and I can assess their pulse rate, and I can see that their pulse is maybe rapid, and this might be due to the pain. Or maybe that their blood pressure is high. These are things that are measurable and things that I can actually see. Lastly, pertinent negatives. These are things that you would assume to be pertinent to the call. For instance, if a patient's complaining of chest pain, it would be pertinent to also ask them if they're complaining of or having shortness of breath. So if a patient said, yes, I'm having chest pain, but no, I'm not having shortness of breath, then it would be that a pertinent negative. Patient has positive chest pain, but negative short of breath. So that would be a pertinent negative. Another example of this would be nausea and vomiting. The patient complains of nausea, it's pertinent to ask about vomiting. You're feeling nauseous today? Well, have you vomited? Right? And if they say no, again, that's referred to as a pertinent negative. A major legal concern for you as an EMT is confidentiality. If you remember from Chapter 3, confidentiality is governed by the organization HIPAA. Now, you can have, if you breach HIPAA or you breach confidentiality with your patient, a $250,000 fine and even up to a year of imprisonment. So it's important to make sure that you keep your PCRs confidential. Nobody should be looking at your PCR, all right, unless these certain instances that are listed below. For instance, if another healthcare provider wants to read your PCR, that is okay as long as they're going to be continuing patient care. You can't have any person read your documentation. They need to be in direct patient care with that patient. Another option is police. If police need your PCR for investigation of a criminal offense, right, that is okay. Or if you get subpoenaed in court for a case or a call that you had, again, then it's okay to release your PCR. And lastly, the only other time it's okay to release your PCR record is for third-party billing information. Every PCR that I fill out, I give back to my company, and my company is responsible for billing for that information, for the treatment and the call that we provided. One of the hardest calls for an EMT to run is the instance of a refusal of care, or a situation where a patient doesn't want your help or doesn't want your care. Sometimes these are referred to as against medical advices or AMAs, or sometimes just refusals. Like I mentioned, refusal of care situations are some of the most difficult calls that an EMT can run. Below on this slide, you can see that this is an example of an AMA form or a refusal form, and you can read through the refusal form to see what might be important for the patient to know. It's important that the patient understands that they are releasing us from liability and that they are assuming consequences up to and including death. When we have a refusal form, a couple things that are important for protecting ourselves in these situations is, if possible, complete and document a physical assessment on your patient. It's also good to try and persuade your patient to accept treatment and transport to the hospital, and document that you've told the patient so. It's also important that you make sure that the patient has a capacity to understand. Remember, this patient should be alert and oriented × 4 and not under the influence of any drugs or alcohol. So make sure you document that fact. If you need to, always consult with medical direction whenever you're in doubt. If the patient still refuses to go, clearly document what you told the patient and their response to you. Before you leave the scene, it's important to encourage the patient to seek help if certain symptoms are to develop or if they change their mind. And make sure that if they change their mind, you're always happy to come back and help them in that situation. There's a lot to consider when documenting for a refusal situation. So try and get some practice. Ask other instructors what they've done in those situations, and learn how to document those when you get into or before you get into a refusal situation. All right, who's not perfect? Let's be honest. If you mess up on your PCR, that's okay. We have ways to fix them. However, remember, if you didn't do it, don't write it down because falsification of a PCR can lead to loss of licensure and even criminal charges. So do not falsify a PCR. However, if you made a mistake on your PCR, all right, it's an easy fix. As you can see above us, what you're going to do on a written PCR is make one line through the word so that it's still readable, and then initial with your initials that you've made the mistake, and then correct the mistake. On an electronic PCR, obviously we can backspace and we can delete whatever we've just typed. However, if you've already submitted your PCR and you've made a mistake, we can always attach what we call an addendum that will follow along that PCR with the correct information. An addendum is a little bit like a trailer that whoever were to open that document or were to open that PCR, they would also see that addendum or that trailer along with it with the correct information that you intended to write down. We have a couple special reports that we need in certain situations. Our first situation is an MCI or mass casualty incident. Your book will refer to this as any incident that overwhelms personnel or equipment, and sometimes is over 3 patients. If we have too many patients, we're not going to do a piece of a PCR on every single patient. Instead, we have triage tags. Seen down in the lower right-hand corner, there's an example of triage tags, and we'll learn more about these as this class goes on. Other situations are any possible exposures, either to infectious diseases or hazardous chemicals, or even injuries to the EMS provider. You'll have to follow your specific department or company's policies and procedures on how to deal with and document those exposures. Then lastly, suspected child or elder abuse, the appropriate authorities should be notified. In this situation, that might be CPS or APS, Child Protective Services, or Adult Protective Services. Make sure you fill out those reports appropriately and correctly, and turn them in along with your PCR. Below are a couple documentation aids that you have to help you form and write a narrative. We have SOAP, we have iChart, and there's a couple other ones in your book as well. Talk to your instructors. Ask them what they use when they write a narrative and how they do it appropriately, and if there's any aids or recommendations they have to appropriately filling out documentation. You can find one that works well for you, and then you will be trained on how to do a lot of this stuff and how your company wants to do it when you get out in the field.